welcome to the Now-fertility YouTube channel. I have great pleasure tonight to be joined by two colleagues, Andreia Trigo and Sarah Banks, with whom I will be discussing a very important topic for all of those individuals undergoing fertility treatment. We aim to address the issue of helping to reduce stress during IVF treatment, and I could not think of anyone better than Andreia and Sarah to join me tonight. A brief introduction about my guest, Sarah Banks. She's a fertility coach and author. She offers training to fertility professionals to enhance the support they offer to their patients. And as a former patient, she is very well aware of what the patient's needs are. Andreia Trigo is a nurse consultant, is a lecturer, researcher, and TED speaker. Is the founder and CEO of Enhanced Fertility, and her mission is to improve accessibility to personalized fertility care at minimal cost for everyone. Welcome, Sarah. Welcome, Andreia. And thank you once again for joining me this evening.
For me, one of the biggest things I feel is for people to seek support with whatever form of support is right for them. So when you're going through treatment, I think it's really important to seek support. And there's so many people now that are there to support in different ways, so you can find something that's right for you. So whether that's going to see a fertility counsellor, which I'd really recommend doing, because I think it's worthwhile speaking to them just to make sure that you're talking through some of the emotions you're feeling going into treatment and helping you cope. But there's also lots of different support groups out there that can help you as well, where you've got peer support from others who really understand what it's like to go through it. There's lots of different holistic therapists that offer support as well, fertility coaches like ourselves, and there's so many different accounts now in places like Instagram where you can get support as well. So certainly when I was going through treatment, support is something I really missed, and now I think it's one of the main coping tips I would say as you're going through treatment, because it validates how you're feeling, and other people who've been through the same will be able to offer advice to you as well, and you can talk to them about how you're feeling. And so that's one of the things I would say is really important.
Does fertility coaching work?
That is a good question. I think if we think about, for example, when we go to the gym, if we have a fitness coach and he can guide us because he's an expert, he's done it, he does it every day and supports other people, we are more likely to get to where we want to be. So fertility coaching is a bit like that, and it can be, coaches can be different people from different backgrounds, and that's why it's important for you to find someone that resonates with you, that can give you what you need in terms of more emotional coaching, physical support coaching, all of these different things are possible, but mostly I see it as a way of taking you from where you are to where you want to be in a supported way, in a faster way. What do you think, Sarah?
I agree, and I completely agree on finding somebody that's right for you as well, and I think that's when it's much more effective, isn't it? And for me as well, it's about taking control and helping you take control of your journey and of your life as well, whereas you maybe feel completely overwhelmed with everything you're going through. Going to see a fertility coach, you can start to talk through how you're feeling and start to create a plan for moving forward, however that looks like for you, whether that's making changes you need to age your fertility or just so that you feel stronger emotionally. Working with a coach can keep you accountable so that you don't sort of stop doing what you're doing to help you feel better. They can keep you accountable, but also help you start taking control. And so the support groups that I run and my own personal journey, I've really learned that control is something we all really struggle with when we're going through infertility and going through IVF, that lack of control. And I think a fertility coach can give you some of that control back.
Thank you. I think I would like to sum up that by saying that while patients turn to doctors and fertility specialists for clinical care, I think they should turn to a fertility coach to have a partner on their side for everything else. Coaching support is important and can help dealing with the emotional effects of treatment, can make beneficial lifestyle changes, and sometimes can help give confidence to continue the journey, which may be bumpy, and for some may not reach the outcome they want. And we'll move on to the second topic. And we're approaching a time of the year when families get together, when children become an important part of our lives. For some fertility patients, may be a difficult time of the year when they have to cope with triggers. So what is your view about that, and what advice would you give to patients?
I think it's so interesting because this time of the year, there's all the adverts on TV of what a normal family looks like. There's also the reminders on everywhere we go, of the Christmas lights, of what a Christmas should look like. And then it's also the end of the year, a reminder of maybe what we have not been able to achieve. So it's so incredibly hard to go through all of that. So I think, number one, there's all sorts of things that we can do, but I think my key advice would be to do this season in your own terms, what is right for you. If you feel like you cannot cope with going to a Christmas party, then don't. If you feel like you cannot cope with the questions that some people might ask you, maybe you can prepare some questions beforehand, some answers beforehand on how to answer that. But trying to recreate new traditions around what Christmas looks like for you in your own terms, and try and keep hopeful for what the future might bring. Like Sarah said, it might be a different outcome to what you had planned, but remaining hopeful that whatever the future holds might be a very happy future as well.
Yeah, and I completely agree. It's a very difficult time of year. And I think, like Andreia said, the most important thing is to understand it's okay to not want to do certain things. Don't feel that pressure. And it's really difficult because I think families can put quite a lot of pressure on. There's often lots of events. I think it's remembering it's okay to say no to those things. Doing things that you enjoy, so whether that's spending time with your partner and doing things as your family unit, planning time out and things like that you want to do so that you enjoy Christmas, and redefining what it means to you, and just thinking about some of the people that you can spend time with. So maybe if a lot of your groups of friends have got children, which ours did when we were trying, and it was very difficult, you maybe don't want to do things with them. Think about other groups of friends you've got that you could do things with, or do things with your partner. And I'd also say try and think about things you can do if you are going through treatment as well. A lot of people say it's very difficult if they've got works, Christmas dues and things like that. If they're not drinking, they're trying to hide that. So think of things that don't revolve around drinking if you're going through treatment, so that you can still enjoy Christmas time, still celebrate and go out and do some of these things and socialize. But think of things you can do outside of drinking. So if you are going through treatment, or you're trying and you want to hide that fact, it's a bit easier if you organise maybe going to a Christmas market or going out for food rather than just focusing on drinking as well. But yeah, I would definitely say the most important thing is to remember that it's okay to not want to do things and to say no for things, and make up an excuse if you need to get out of things.
I think people going through fertility treatment to build a family often endure a real emotional and mental toll, and perhaps they should realize and should sometimes accept that they can find ways to cope with their partner or friends or families. And I personally recommend that individuals and couples that have not been successful in the last 12 months, they should not look at their last 12 months with negativity, but instead they should look at what can be done in the future, in the new year, to support them in the new journey. And I agree with you both that I think there should be no pressure from the community, no pressure from the society to do things they don't want to do.
The strategy that I've been using a lot is the use of a gratitude jar. Every time we remind ourselves of something that happened really good this year, I may still not be pregnant, but maybe I learned something about my body, so I'm closer to that journey. Anything that happened that was really good, that I'm really grateful for, write it down in a piece of paper and put it in the gratitude jar. And having that visual representation of a jar full of things that happened that were really good during the year, I think can also give us hope, renewed hope for the new year.
I think reading back over those things will be really a really positive thing to do as well, won't it? And really remind you of some of those things that you're grateful for.
Thank you, Sarah. Thank you, Andreia. And we'll move on to the last topic, which is helping to make changes in the new year. And we've already touched on the new year, and we touched on how important it is to be positive, stay positive. And there's no doubt that fertility coaching can help to make changes and manage the negativity in some cases of what has not been achieved in the past 12 months. So could you please tell us what women and men and couples, individuals can do to make positive changes for the future?
I think, first of all, I mean, a lot of us will make New Year's resolutions and things, and there may be things we think we should do, but maybe have a think around some of the things you'd like to do instead of seeing it something you should do and something that's a bit of a challenge for you. Think about some of the things you'd like to do so that you can then make a list of some of the things you want to do outside of trying to get pregnant. Think of some of those different things you want to do so you can start creating an action plan. And I think for me, certainly when I talk to people, the biggest thing is about this control again. Have a think of the things you can take control of in the new year. So whereas you might be feeling completely out of control of your ability to get pregnant, and when you're handing over the control to your fertility consultants to put through IVF, if you know you're going into that in the new year, have a think about the different things you can control, like lifestyle factors that you can control. So eating well, getting enough rest, supplements that you need to take, things on your mindset. How do you feel you would be better coping? How can you control that? Who could you speak to? What could you do? And then some of the practical things, so maybe researching treatment, researching clinics, and taking control of some of the practical side of things, so that going into treatment you're feeling more informed and more in control of things.
I completely agree with you, Sarah. I think there's so many things that we can still be in control of in terms of diet, activity, exercise, looking for the specialists. For someone who might just getting started, maybe they find themselves a bit overwhelmed by the number of things that they could be doing. And for those people, I would say maybe choose one thing that can be used as a trigger for everything else. For example, in my case, I would always say that for me, what tends to pull me forward is having a reason why. So connecting with myself and why I want what I want. How will my life look like when I get there? Usually ends up being my driving force, and it makes making those lifestyle changes much easier. But I think equally for maybe a lot of people who have been trying for a long time, maybe they are already doing a lot of these things. So it can be a bit daunting to think about what else am I missing? And sometimes there's just an element of luck in trying to conceive. We cannot control everything. So I think for those people, it might just be the fact of getting new opinions, connecting with more experts.
Thank you. Very, very helpful. And thank you once again, Sarah and Andreia, for joining me tonight. I would like to close this session by wishing all patients the very best for a successful 2022. I would like to say that fertility coaching can be beneficial at any stage in the fertility journey, from very, very beginning when investigations being carried out to when the treatment is unsuccessful. Making healthy lifestyle changes is also important, setting goals, and finding a positive person you can talk to throughout the journey is fundamental. I would like to thank Sarah for joining us, and also Andreia. And if you wish to ask any questions directly to Sarah Banks and Andreia Trigo, you will be able to do so by following the social media pages. Thank you very much indeed once again.